I've been involved with True North and ACE maintenance activities through the Thrive Center since 2016. I've met many of the staff and the volunteers from the Health and Wellness Lab. And even though I have not been enrolled in Excel, I want to extend a hearty welcome to Julianna Dreger and her colleague Jocelyn Cannon. I think it was in August 2021 when we last had the Wellness Lab do a presentation for us. So I'm excited to learn what's been happening there since then. Julianna is a project coordinator who started with the Health and Wellness Lab back in May 2020. So if you can imagine starting a new job right in the middle of COVID, what a challenge. Her role within the lab is as the project coordinator for the Project Excel, which is short for Exercise for Cancer to Enhance Living Well. I can see why she shortened that, because on the business card, Excel is much more eye-catching. It's a program aiming to increase the access of exercise therapy to rural and remote cancer survivors right across Canada. So it was, I believe, started here in Alberta and spread its wings. Jocelyn is a master's student at the University of Calgary's Health and Wellness Lab. She's looking to investigate the impact of yoga and mindfulness techniques on fatigue and energy levels of individuals living with and beyond cancer. She's also a research assistant for Excel. And I can tell you, I got connected with the yoga group, and our yoga on Monday, or Tuesday night, Wendy and I got our flu shots and our COVID shot in one arm. I've never done one-armed yoga before, but I'll tell you, it was a good core workout, that's for sure. So with that, I'm going to turn it over to, I believe Julianna is going to start us off tonight.
Awesome. Well, thank you for the introduction. Like Brad said, I'm Julianna. I'm a clinical exercise physiologist and the coordinator for the Excel study. And I have Jocelyn helping me out with the presentation as well. The last time I was presenting for prostate, I had Manat helping, and she was a master's student, and now she's moved on to her PhD. So Jocelyn is filling in her shoes. And I also have a guest. I have Robert here, who is a previous ACE participant. So at the end, he's going to speak to his experience, because I think his voice is probably a lot more powerful than mine. So I'd also like to just do the First Nations acknowledgement, saying that we acknowledge and pay tribute to the traditional territories of the peoples of the Treaty 7, which include the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda. The city of Calgary is also home to the Métis Nation of Alberta Region 3. And our lab would like to also acknowledge that Project Excel and all of our studies will champion equity, diversity, inclusivity, and accessibility within our team members, our research questions, our training, our programming, and development of resources. Okay, so what I'll do is I will give you a little bit of an update on our projects and what we're doing in the lab, but I want to go over the importance of exercise and why we are doing what we do in the Health and Wellness Lab. So we know that with more effective treatments, more people are living longer with and beyond cancer. So we want to ensure they are living well. Supportive services are needed to better support individuals living with and beyond cancer, who are often living with side effects for years beyond treatment. Our lab ultimately hopes that cancer care systems across Canada will integrate exercise into standard cancer care to ensure patients are provided with the appropriate resources to support their physical activity needs. So this ultimately is our goal. We do want someone like myself, an exercise physiologist, working in hospitals, working in cancer clinics across Canada, just as if, you know, you might be referred to a dietitian for nutrition advice, or a social worker to connect you with things in the community. There would be an exercise physiologist in cancer clinics to direct you to exercise resources, whether that's a class or, you know, a walking group or something like that. So we have years of research showing the benefits of exercise for those living with and beyond cancer. We know that it does not undermine treatment, which is important. Where a patient is on this continuum will dictate what kinds of goals we have and the sorts of prescription, the exercise prescription we would use. So for someone who's pre-treatment or pre-surgery, we'd be looking to improve your physical outcomes as much as possible to reduce the amount of potential decline. And then if you're on treatment, we're really looking to maintain or reduce the amount of functional decline. After post-treatment, we're looking to work with rehab services like physio or occupational therapy and really use exercise to improve your fitness and function again. Really try to get you back to doing activities that you love. And then into advanced care, we're looking to improve or just maintain quality of life. So you can see here, there are a range of benefits from engaging in exercise. So the usual things that you would expect, like improving your fitness levels or improving your physical functioning. But exercise can also positively impact mood. It can improve fatigue. It can influence bone health and ultimately quality of life. And we know that regardless of the exercise intervention type and duration, those who are more active have a better quality of life than those who are inactive. So finding an activity or a movement that brings you joy and that you want to keep going back to is really important. So I want to briefly touch on cancer-related fatigue. It is the #1 reported side effect, yet it's so hard to treat because there's so many factors that can influence it. You can see here the vicious cycle of fatigue, which is when you start off feeling tired, you have less energy to move, and therefore your sedentary behavior starts to increase. And this causes deconditioning, which means reduced fitness, and muscle atrophy, which is muscle loss. And then that feeds into the feelings of fatigue even more. So even after doing just some daily activities, it's really hard to get motivated and to have the energy to even think about doing something like exercise. So the cycle will just continue and continue as you get less and less energy. However, exercise, if appropriately prescribed, can improve fatigue levels. So what does this mean, appropriately prescribed? This means start easy, start easier than maybe you think you need to, and slowly progress and really reflect a lot on how you're feeling. So how you're feeling during the exercise, how you're feeling right after, and then even the day after that. So what we're looking for, our energy levels should slowly start to be increasing, and those fatigue levels should be starting to decrease. This can take a little bit of trial and error, especially if you were active before, or you have certain expectations about how you should be moving or feeling when exercising. But be honest with yourself, take time to reflect on how you feel, and then just modify based on that. So it doesn't mean you have to, if you pushed a little bit too hard, it doesn't mean you have to just stop it completely and that's it, throw in the towel. Just reduce the amount of intensity, or maybe the time, the duration that you're doing that exercise. Another thing to touch on is exercise's impact on mental health can have a huge positive impact. It can improve your mood. It can improve the risk of depression and anxiety. It can improve body image. It can also improve self-efficacy, which then can translate into other realms in your life. So if you feel confident in your ability to do exercise, or to consistently go for walks or go swimming or whatever the movement is, that confidence can then translate to other areas in your life. We can also see it improves a sense of control. And in times when you may feel like you have little control, when you're told where to go, what to do, what treatments you're going to be on, all of the appointments, having some control because of exercise can really be a positive thing. So you get to decide when you're doing the exercise during the day, how intense it's going to be, how long you're going to do it for, and what movement you want to engage in. This can be really impactful. We also know that there are some survival benefits. So a modest amount of moderate to vigorous activity. So for those living with cancer, we're aiming for 90 minutes a week. This is associated with significantly reduced risk of cancer recurrence, significantly reduced risk of cancer mortality, and significantly reduced risk of all-cause mortality. And for those specifically with prostate cancer, we know that exercise can have a positive impact on body composition. Based on certain treatments that you might be having, you might notice an increase in fat mass and a decrease in muscle mass. And exercise can actually combat this and increase that muscle mass. We also know, like I said, that it can help with fatigue management. It can also potentially help with incontinence. So we always recommend that you reach out to a pelvic floor physio if you have incontinence issues. But with those exercises, along with appropriately prescribed exercise from an exercise physiologist or a fitness professional, that can improve that incontinence. Also, like I said before, we're looking to improve the quality of life, and exercise can also help reduce the risk of developing comorbidities. So through years of research, exercise guidelines and recommendations for people living with and beyond cancer have been created by experts from around the world. So like I mentioned before, it's suggested that you get 90 minutes of moderate intensity activity per week. This can be broken up however you want. So it could be multiple 10 minutes of bouts throughout the week. You could do 30-minute bouts 3 times a week. It's whatever is appropriate for you. We're also aiming for 2 days of strength training and flexibility training most days of the week. And then, like I said, that pelvic floor training or exercises as recommended by a pelvic floor physio. So these are great recommendations. We love giving these out. However, if your oncologist were to hand you a piece of paper that had this information on it, would you feel a little bit overwhelmed? Or would you know where to start? What is safe? What you should be feeling? How do you know when it's too much? When we think about just the general healthy Canadian population, I think we might be at 50% actually get the recommended daily amount. So when we think about asking those living with or beyond cancer to start getting active, it's pretty hard expectation. So that's why sometimes we need a little bit more help other than just these recommendations. So that's why we talk about, you can see at the bottom here, why individualization and tailoring are critical for success. So we need to consider your fitness level, your age, disease status, what support you have around you, the social support, what barriers you might face. And this is where potentially an exercise physiologist or kinesiologist could screen and appropriately triage you to programming and resources. And they can also support behavior change to ensure you continue engaging in exercise. But our key message is not to turn you off of those recommendations and not to make you feel like you need to work with a fitness professional. Ultimately, moving more is the key message. Even though we have the guidelines, it's important to note that some movement is better than no movement. So adding in 5 or 10-minute bouts of exercise throughout the day or week, it all adds up. We're going to talk about some specific exercise programs that many of our participants have enjoyed, but ultimately finding movements that you love doing is critical because then you're more likely to keep it up and continue moving long term. Of course, making sure you follow guidelines post-surgery is very important. So it usually takes tissue like muscle and everything to heal in about 6 weeks. So this is why there can be certain limitations on what or how much exercise or movement you should be doing post-operation. So just go with the guidelines that your surgeon has provided you from that point. And then listen to your body. So you are the expert in your body. And make sure you're taking that time to reflect on how you're feeling. And know that, like I said before, it's trial and error. Some of you might feel like you're in almost a new body, or you need to get to know this new sort of feeling or whatever after surgery or after treatment. So it does take some trial and error to figure out what feels good now and how much is too much. And like I said, just kind of fine tuning that, reflecting, and taking time to think about how you're doing is really, really key. So one thing that you can use is this rating a perceived effort scale. So it's 0 to 10, where 0 is on the couch relaxing and 10 is you're working as hard as you possibly can. So I'm going to give you a bit of a range, and it's because it really depends on how you're feeling day to day. So all of our participants in our exercise programs, we just ask them to show up, regardless of, if they're really feeling terrible and they can't make it to class, that's fine. But if they feel like they still want to attend, we are going to meet them where they're at. So on days where they're not feeling wonderful, we would say just work at a 2, a 2 out of 10 intensity. But if you're feeling better and it's a good day, maybe you're working between a 4 and a 5. Once you're getting into the 6 to 10, this is where you're really pushing a little bit harder. And you don't necessarily need to go quite into those levels. So especially if you're just starting out and exercise is new to you, kind of work between that 2 to a 4 and see how that feels for the first couple weeks. Then if you're feeling awesome consistently, then maybe you can push up a little bit higher into that 4 and 5 category. So that's just a nice scale that you can use to reflect on when you're thinking, how am I feeling right now? How am I feeling after the exercise that I did? So like I said, all movement is beneficial. Start small and take part in activities that you know you can do to really feel accomplished and get you that boost of confidence. You can always try some new activities to switch it up, but as long as you're doing a little bit every day for health and wellness benefits, that's what's important. Consider social support when you're thinking about starting new activities. It's easier to maintain when you have some support. So ask your family or friends to maybe get active with you, or just ask them to help you be accountable. So if you have certain goals, maybe you just want to start walking, for 5 or 10 minutes every other day. So if you tell your buddy that that's what your goal is, and ask that person to check in with you to make sure you're staying accountable to yourself. Or potentially you're someone who would do well with doing an online group activity or an in-person group activity. You need that group to keep you accountable. So just think about what is going to work for you and what kind of social support you need to be successful. And finally, consider potential barriers that you might be facing. So again, like I said, think about what you enjoy. Don't force yourself to do something that you know is really not your thing. So if, joining a group class isn't your thing, that's okay. You don't have to force yourself to do it. Maybe going to the gym is really not what you would enjoy, and that's okay too. There's lots of different options to be active. Think about what's accessible though, and think about what is sustainable. So this is where Jocelyn is going to come in. So I'm going to stop sharing. Jocelyn recently completed our fitness professional training, and she is starting to lead some of her own maintenance classes. So she is going to lead you through some movement that you are welcome to do if you feel you're able to do it. Listen to your bodies though, and of course take into account any considerations that your healthcare team has provided regarding exercise. So I'm going to just stop sharing, and then I'm going to spotlight Jocelyn, if that's okay. Brett. Awesome. Okay.
Okay. Okay. Hi everyone. I'm sure you're there. I can't see you, but as mentioned, I'm Jocelyn, and we're gonna take, oh, there we go. We can see some people. Awesome. We're gonna take about a minute here to move our bodies. So I'll start a timer. I'll encourage everyone to stand up if you'd like. If you would rather be seated, that is totally okay. We're gonna take a minute to focus on our lower body for a second here. So maybe doing some squats. So just dropping down, chest forward, hips back, maybe a sit to stand with your chair. I encourage you to not use a rolly chair if that's what you have. Or if you're seated, we're going to move into some leg extensions. So straightening the knee, maybe both at one time, maybe one and then the other. I'll start the timer right now. So moving for 1 minute, listening to your body, maybe just thinking about, I don't know, something. I don't know. I didn't prep this part. Taking a minute. Think about maybe some goals you're setting for yourself right now with moving more, getting some physical activity in your day. It's been 30 seconds.
Oh, it's a
Always
long
at
minute.
your pace. It's a long minute, but everyone's doing awesome.
Shake those legs
Great
out
job,
if you need
everyone.
to.
Always taking breaks when you need. Always moving your body in your way. Awesome job. We have 5, 4, 3, 2, 1. You can sit down. Awesome job, everyone.
Good job, everyone. Thank you for joining us. We have to practice what we preach.
Yeah.
All right.
Hopefully everyone's feeling more engaged after that.
Okay, let's get those slides back up. Catch your breath, everyone. Maybe grab some water if you need it. Okay, so let's go into the next slide. Okay, so now I'm going to talk about our exercise oncology resources. So to start off with, you may be aware of the programs through the Prostate Cancer Center already, but there are some exercise classes that they offer. So I encourage you to check their website out for their offerings. I know they definitely have the strength and stretch. I don't know if brain and brawn is still going on. So check out their website. And then Wellspring, I don't know if any of you are aware of Wellspring, but it is a not-for-profit. It's free to become a member. They have a variety of exercise classes and more. I know they had some, I think, a climbing class. They have pole walking. They have lots of different options. So check them out. Not only do they have movement classes, but they also have all kinds of additional resources. So managing finances. I can't think of anything else off the top of my head, but they are an awesome organization. So definitely check them out. All of their classes are delivered by trained exercise professionals. And the website is just listed there. And then our labs, the Health and Wellness Labs YouTube channel, we have a 12-week pre-recorded exercise oncology program. So even I am featured on it. Maybe don't watch my weeks, but my colleagues also have gone and recorded the 12-week sessions. So that will give you a taste of what the ACE and Excel programs look like. And the instructor is, you know, at the front of the studio, and you can just play that in your own living room and follow along for the whole hour-long class. So there's 12 classes that are up on that. We also have some really great education material as well. So we had some previous education weeks where we invited participants, previous participants, members of the community, and qualified exercise professionals to learn all kinds of things about exercise oncology. So lots of resources on our YouTube channel. And then we have the free Thriver manual. So this is a 90-page evidence-based resource package. 10 different chapters. They cover lots of different elements of, you know, the importance of exercise, how to get active safely, how to tailor exercise to your needs. There's always some information about behavior change and a little bit of information on eating well and diet. So you can visit the website down here. And what I can do, Brad and team, is I could send just an email with some simplified slides that have the links to everything as well, in case anyone wants that. And then we have the exercise oncology programs through the Health and Wellness Lab. So we have the ACE program, which Brad spoke about. So that is the Alberta Cancer Exercise Program. So it started in 2017 as a research study. And recently it has transitioned into more of a community program. So there's less measurements and all of that sort of thing, and it's more focused on just being a program in the community as it was intended. Based on the success of ACE, we created the Excel program. So Excel is taking the exact same 12-week program across Canada, and it's for those in rural and remote locations. So we know that often those living in urban communities have access to hospitals and all of those resources associated there, as well as universities that often have these research studies. So those in rural communities tend to be left out, and that's where Excel is coming in. So for you folks in Calgary, this probably wouldn't be the right program necessarily, but if you know of anyone in more rural areas, please let them know about Excel. But for those of you in Calgary, you would be eligible for ACE. So both ACE and Excel, doesn't matter what the name is, it's a 12-week program. It is for anyone who is pre-treatment, on treatment, or within 3 years post-treatment. There is a caveat to that. So for anyone who is beyond 3 years post-treatment, if you still have treatment or cancer-related side effects, get in touch with us. And we will just reach out to your healthcare team and get a referral indicating you would benefit from exercise. So our next programs will be starting in January. So if you are interested, please reach out right away. You can send us an email at wellnesslab@ucalgary.ca, and we will start the registration process. We'll get you on a list. And then as program organization is done, you'll learn more about the offerings that we have. So the program is 12 weeks. Like I said, the classes are twice a week. They are 60 minutes long, and we make sure, especially for our online programming, that instructors are available for 10 or 15 minutes before and after to really develop that community that naturally happens much easier for our in-person programming. So whether it's in person or online, we incorporate cardio, we do resistance training, there's some balance and flexibility. So we really try to get everything in there to hit all of those different targets. For our online classes, if that's what you're interested in, we really take safety importantly. So we have the instructor who has been very well trained with our training protocol. We also have a secondary person watching at all times. So they are watching for safety. They make sure no one is wandering off screen, that we can see everyone moving and helping with the queuing as well. And then we always make sure we have everyone's physical address. So in case anything happened, we could send emergency services your way. Class sizes tend to be 8 to 15, depending on, the in-person classes. It might be a little bit smaller depending on the studio size. And one thing I'll note there, for those of you in Calgary, like I said, as we get our ducks in a row with the programs for the winter, we'll let you know about the different locations that are offering classes, but we do have most of the quadrants of the city covered off. So although I preach all about exercise prescription and the importance of exercise, we do really want to make sure that our instructors know that this is beyond just the exercise prescription. So people talk about the reason they stay, and Robert a little bit later will discuss his experience with ACE, but people keep coming back to the ACE program because, it is a great exercise program, but it's also the community that is developed. And although you might have an awesome support group, and those, your family members and everything, it's different when you are working and talking to and exercising with those who have gone through a similar journey. So just like those in the room, you really understand at a different level. And that's why people keep coming back to the ACE and Excel programs. We also make sure that we don't use a push mentality. So our instructors aren't running a boot camp. Like I said, we're just meeting participants where they're at, because we really want to support people to become lifelong exercisers. So we focus on behavior change education topics as well. So we'll talk about goal setting, social support, and that long-term maintenance. So it isn't just the exercise, we build a community, and we also have education along with it. So here are some common questions that we might get asked. So someone might have a bad hip or aren't comfortable getting on and off the floor. Is this program right for me? So we do have exercises in all of the classes that are floor-based, but we also have modifications where you can just do it in your chair or you can do it standing. So we always offer lots of modifications. And if something doesn't feel good, or if you don't feel safe in a certain position, you can talk to your instructor, and they have lots of tricks up their sleeve, so they'll provide a different option. What about, you haven't done exercise classes before. Do you need previous experience to join? Absolutely not. You can come in. We really start from the basics. We want to make sure that you have a really solid foundation before we start moving forward and progressing from there. And we have people who have never exercised before to those who have exercised or looking to, do a half marathon or something. We really do have a whole range of different abilities in the class. And our instructors are so well trained to be able to support all of those different abilities. And everyone can work in the same room together really, really well. I have no equipment. Can I still participate? So for those of you interested in online programs, but you don't have any equipment at home, that's okay. Neither do I. I use my textbooks and I put them in my backpack for some weight, or I use soup cans. You can use water bottles. So we'll use whatever you got. Like I said, we'll meet you where you're at. What about if you're on treatment or you don't feel good for a few days after having treatment? Should you join now, or should you maybe wait until later? So it really does come down to what you're feeling and what you think is appropriate for you, because you know your body. But I have had some participants join the Excel program and they've been on treatment. And sometimes they'll just log on for being able to see their classmates, and they do a lot of the exercises seated rather than getting up and engaging in a higher intensity version. And for them, it's just about connecting with the instructor, connecting with their classmates, and having a reason to log on and engage in a little bit of movement, even though they aren't feeling wonderful. So in summary, we will meet you where you're at, regardless of previous experience, your current fitness levels, or the equipment that you have or don't have. We will modify the program based on whatever your needs are. So Jocelyn is going to take over again. Don't worry, it's going to be much nicer. We're going to do a little bit of stretching, I think.
Okay, perfect. We can all stay seated for this, or you can stand up. We are just going to go through a couple shoulder and back stretches. So I'll encourage you guys to kind of move with your breath. This is yoga teacher Jocelyn speaking now. So we'll inhale, roll your shoulders up, and exhale, pulling them down. And keep moving with your breath. And allowing your shoulders to relax. Maybe switch directions, going forward. That feels good. Again, always listening to your body. Maybe we inhale, bring our hands wide, although it is a tight room, so mind the person next to you. And exhale, pull one arm across your chest. Make sure your shoulder's away from your ear. Getting into a bit of a shoulder stretch, maybe reaching your fingertips away from you. And then let's inhale, open wide again. And exhale, switch sides. And the fingertips reach away again. Full inhale and exhale, release. And that was your minute. This time a lot nicer.
That was a nice minute. Everybody likes stretching. Okay, I will just leave you with our participant voices. So there's a few quotes here because like I said, I think we have some pretty great programs, but it really comes down to participant experiences and what they think. So I'm going to introduce Robert. So he was, well, still is, he did the ACE study and has been doing the maintenance program. So I'm just going to stop sharing. A little flipping around between screens. Sorry about this. And I will spotlight Robert here.
Hi, can you hear me?
We can.
Okay, good. Thanks. Hi, I'm Robert Morris, and I'll just get straight into my story here. I was diagnosed with prostate cancer in the spring of 2021. I had a transurinary resection of the prostate and shortly afterwards began ADT and radiation therapy. I was putting on weight, especially around my stomach area, and kept thinking I should be doing something more than my twice a day walks with our dog. My doctor suggested I inquire about the Alberta Cancer Exercise Program. So in September 2022, I took the plunge and registered in the 12-week program at the University of Calgary Thrive Centre. In addition to gaining weight during that summer, I was generally more tired and had bouts of depression, but I was looking forward to the ACE program. The course began with an assessment. Values measured included blood pressure, balance, grip, flexibility, etc. After 12 weeks, they were measured again, and indeed, they had improved. My weakest result was flexion, so I've been paying more attention to my flexibility over the past year. Perhaps most importantly, I became hooked on exercising, and I registered in the exercise maintenance program, a 12-week program running all year. By September this year, I had exercised for a full year with the ACE programs. I have noticed improvements in my physical and mental health. I don't get as fatigued and have a more positive outlook on life. And some of the excess fat must have turned into muscle. And I was particularly thrilled with building muscle because as one gets older, it is more difficult to build muscle. I don't think I mentioned that I'm 75, so I was really thrilled with more muscle. My endurance improved. For example, I can walk further more quickly. I now exercise at least every other day. Many exercises can be done at home. For example, balance, cardio, stretching, brisk walking, just to name a few. Just a few words about the actual classes. The instructors are CETs, that's certified exercise physiologists, and they can adapt the exercise to each individual. When I first started the program, my back was painful when I did the mat exercises. So the instructor showed me how to do the mat exercises in a seated position. Incidentally, I no longer have difficulty with mat exercises, another benefit of the exercising. Classes are structured to exercise the upper body, the core, and the lower body, along with a cardio session. There are 10 people in my current class. It's a mixed class, and 2 of us have prostate cancer. We all exercise hard. well, as hard as we can. There's laughter and there's music. I must admit, I was never keen on group activities, but I've thoroughly enjoyed the Alberta Cancer Exercise Program and continue to enjoy exercising. Thank you for the opportunity to speak about my experience with the ACE program. Thank you all.
Thank you, Robert. Thank you very much for sharing. Okay, I will just remove the spotlight. So that concludes our presentation. Like I said, Brad, I can share, I can send an email with the links to the different resources and contact information for the ACE and Excel programs. But yeah, we just want to thank you so much for the invite. It was great to speak again.
That was excellent. Just one quick question. For the Excel program, is Strathmore considered rural?
Yes, Strathmore is rural.
But Airdrie's not.
Airdrie's not, because we actually have ACE running in person in Airdrie.
In Airdrie, okay. Yeah, so High River might.
High Rivers Excel. If it's confusing, just email Wellness Lab.
Okay.
Whether you're ACE or Excel, everybody emails the same place, and then we figure out where you go.
Okay, perfect. And I know of all these programs, so I've been in ACE since it started in 2017. I've been at Wellspring, and I can attest to the instructors. A lot of them overlap, but it's a lot of fun. Some of the guys that I exercised with in 2016 in the original True North program were still exercising with ACE maintenance at Holy Cross, and we still do lunch after exercise. It's not always the healthiest lunch, but yeah.
It's balanced.
Yeah. So that's the social aspect part. So thank you for sharing tonight. We appreciate that. With that, I'm going to say thank you to Julianna and her team. That was a great presentation. I don't think I've ever worked up a sweat like I did tonight doing squats, but
It's all Jocelyn.
yeah, it probably did me good because Wendy and I were running a little late and had a couple of slices of pizza for dinner, so worked that off, no problem. Good.
Thanks again for the invite. It was great.
Okay, we'll see you.
Bye-bye.